100 million Americans are suffering from MSK pain or mental pain, and 80% of the time, both. Many turn to opioids, an epidemic that is decimating the underserved and especially our veteran communities. Our veterans, roughly 5% of Americans, abuse opioids at 7 times the rate of the general population and suffer from suicide at 3 times the rate of the general population. Founder and CEO of Zeel. We're a tech-enabled pain management health startup, and we're solving pain for 100 million Americans without opioids or surgery. We're working with multiple health plans and seeking more health plans to join us. We're also raising 20 million plus to capitalize on the opportunity. 100 million Americans are suffering from MSK pain or mental pain, and 80% of the time, both. Many turn to opioids, an epidemic that is decimating the underserved and especially our veteran communities. Our veterans, roughly 5% of Americans, abuse opioids at 7 times the rate of the general population and suffer from suicide at 3 times the rate of the general population. It is our mission to end this crisis through non-pharmaceutical pain management. We're utilizing therapies like massage in the home and cognitive behavioral therapy via telehealth, which are dramatically and clinically proven to reduce opioid usage and save money. Behind this mission is a strong team with a mix of people who've worked together for over 20 years, like Ed, Allison, Marcy, and me, going back to Vault.com days, and tennis champion Venus Williams, as well as Donato Tramuto, a former United Healthcare executive, Ray Mabus, former Secretary of the Navy under Obama, and Dr. Paul Lynch, founder of Pain Doctor Inc. We launched our company in 2013 to bring in-home massage therapy to more Americans. 2 million massages later, we discovered that while consumers often think of massage as a spa treatment, 82% of the time, they're getting it to resolve pain, from acute injury to chronic lower back pain to prenatal discomfort and headaches. Employers utilize our massage therapy service similarly to help employees improve mobility and boost productivity. Hotels use our service to give travelers access to massage. Since our founding in 2013, we've built a really strong brand. It stands for trusted massage that comes to you at home, hotels, workplaces, and spas. We've done over $200 million in transaction revenue, with nearly 1 million people who have downloaded our iOS and Android apps. Press calls us Uber for massage. In the summer of 2020, we pitched VA, the largest health plan in the country, on using massage to treat chronic and acute pain in veterans. The VA approved our service, and we were off to the races on a pilot program. After a 2-year pilot on 3,000 veterans, the results are unequivocal. Medical massage reduces or eliminates pain medication usage. It improves mobility and sleep. It is cost-effective. It saves vets travel time. And Zeel's protocol generates 90% plus compliance on the treatment protocol. Without us, veterans are getting addicted to opioids or undergoing expensive surgeries. Veterans treated with Zeel are telling us that they're no longer taking opioids, they've postponed surgery, or they've stopped ablations and shots. Navy Captain Gail Henry won't be heading back to the pain clinic anytime soon. Massage therapist Paul Hudson says that healing veterans is one of the most fulfilling aspects of his massage career. VA Medical Center Long Beach Patient Services Administrator Jake Ryan compliments us for being the easiest medical provider to work with. This past March, we were approved to launch nationally. We are now gearing up to launch 30 more VA medical centers on top of the original 9 locations, whose revenue has nearly doubled in the first 7 months this year. Each prescription is for 12 massages over 6 to 12 months. 6 months ago, we added tele-behavioral therapy to the VA program to address the mental side of pain, disorders like PTSD and suicidal ideation. Each prescription here is for 26 one-hour sessions over 6 months. Pain market is an estimated $650 billion annually, including treatments and missed time at work. Our addressable portion, which is medical massage for MSK pain and behavioral health for mental pain, is at least $5 billion, with the VA alone at $500 million to treat an estimated 345,000 veterans in chronic pain. We're already expanding beyond VA and have signed 4 additional contracts, 2 for in-home medical massage for chronic pain and 2 for psychology exams for the military. Before COVID reared its ugly head, we had just hit break even on 45 million of ARR. We'll finally be back at that run rate in Q4 this year, But with this new healthcare channel fully developed, growing fast and profitable, we're almost at break even now. We believe we can reach over 100 million in revenues in the next 3 years and achieve a $1 billion or greater exit. We are raising at least 20 million to capitalize on this new category of pain management, where we are the first and only medical practice offering medical massage. In summary, we are Zeel, solving pain for 100 million Americans without opioids or surgery. We're going after a $5 billion market opportunity with a trusted brand that brings to the home a treatment that is low cost, effective, and has no side effects. Thank you very much, and I'm ready to take questions.
Samar, great presentation. I have so many questions. We're not gonna have enough time for them all, but I wanted to start off with, is this akin from an analogy perspective to what Headspace did, where you started off they started off as a meditation business, now moving into more enterprise and ripping a page of Julie Yu saying, hey, prove your solution with the consumer and then take it to the enterprise. What is the strategy in your mind there?
Well, when we first discovered that massage therapy is really being utilized for pain management, even though that's not its perception, we thought, why aren't health plans covering it? And we were contacting plans all the way back in 2017 and 18, and they sort of laughed us out of the room. Like, that's a spa treatment. So it took COVID and this veteran crisis to come together in March of 2020 when we got a call from United Healthcare, who had just become the third-party administrator for VA's community care network. And they decided that massage therapy was something they wanted to try. The scourge of opioids and the COVID lockdowns just exacerbated the problem among veterans. And the VA's brass decided that it's time to give it a shot. We pitched, we won the gig, and it's working. The data are unequivocal, like I said.
Most people, I think of massage as a physical endeavor, but I think there's a lot of mental health aspects to it as well in terms of its benefits. Can you speak to those?
Yes, in fact, the VA has what's called a standard episode of care document that indicates the massage therapy should be used right now only for musculoskeletal pain, so physical bodily pain. But in the data that we've collected from all these veterans, there are all of these mental health benefits: improvement in mood, improvement in sleep, lower PTSD. We have thousands of quotes from veterans, and in many cases, their wives as well, as 93% of veterans are male. When Zeel comes, I get to go out to dinner that week. I sleep. I can take a shower without aid. It really improves their mood and their mobility too.